into a bit about what arthritis is, how it's diagnosed, and the possible treatments that are available, both veterinary prescribed and alternative therapies that you can look into doing if your dog has been diagnosed with arthritis. So, what is arthritis? Arthritis in dogs is a degenerative joint disease that can start as early as 2, where you can see changes, arthritic changes in the dog's joints as early as 2 years old. Sad, isn't it? However, it is more common to see in older dogs as joint function deteriorates with age. So what exactly is arthritis? Arthritis is inflammation of the joint, which makes movement of the joint painful and difficult. It is a progressive disease, so it's not one that your dog just has and will go away eventually. It will get worse over time. There is also osteoarthritis, which is arthritis of the bone, which involves deterioration of the joint and surrounding tissues, including the cartilage, the joint capsule, and surrounding tendons and ligaments. It is estimated that over 50% of dogs and cats, all dogs and cats, will suffer with arthritis at some point in their lives. 50%, that is a huge figure. That's 1 out of every 2 dogs, 1 out of every 2 cats. So how will your vet diagnose your dog or cat with arthritis? They diagnose based on the history you've given them. So say your dog has started to slow up on a walk, it has developed a limp, no longer doing play sessions, or is showing unwillingness to go fetch a ball, things like that, or even licking at particular joints, making them red or even bald to the point where they've licked them raw. These are all telltale signs that something is going wrong and that needs to have a good look with the vet. The vet will diagnose based on a history of symptoms that you have provided them. For example, some of the ones I have just suggested, and will also then do a physical examination of your dog, which will take your dog's joints through their full range of motion, which will then determine whether a joint is stiff, swollen, or painful. If a joint happens to be painful, then obviously that one is the problem, and they can look into that one further for you. The next step on from that to absolutely determine what is going on within your dog's joints will be an X-ray, which is what we did with Nix. So, what is the treatment for arthritis? Treatment is limited to pain relief, anti-inflammatories, supplements, and alternative therapies. There is no cure for arthritis. Once your dog's got it, you're going to have to manage it. So using the pain relief improves mobility in the joint, allowing the dog to move more freely and keep that muscle mass. Keeping the muscle mass improves the stability of the joint and therefore helps the dog in the long term. If the dog loses muscle, then that joint becomes unstable and will make things a whole lot worse for them. The anti-inflammatory medications, same effect, reduces the inflammation in the joint, meaning that they can move around more freely and without pain. Weight management is another big one, making sure your dog is on the leaner side of life so that he isn't carrying more weight than he should do on those joints. So in order for you to know whether your dog is within the healthy bracket, you need to be able to feel ribs, not see them, feel them. And a good way of sort of doing this one-to-one with you over YouTube is having a look at the back of your hand. When it comes to the back of your hand, you can feel the bones in the back of your hand, but you can't always see them. So that is what you want in a good dog weight. When it comes to bad dog weight and being underweight is your knuckles. So I can see all my knuckles. This is bad if you can see all of your dog's ribs. On the other side, you can't obviously feel anything. So this is overweight and you can't feel any bones on this side. So if your dog is overweight, this is what it will feel like. If your dog is underweight, that is what it will feel like. If your dog is perfect or within the healthy bracket, then this is what it will feel like. Okay? Supplements, also great to keep your dogs on throughout the dog's life if you can afford them. Things like glucosamine and chondroitin are normally the main two that you want to have your dogs on. And they are in popular brands like YouMove and Viaflex, and they're in good quantities that are definitely going to be helping your dog on a daily basis. Glucosamine and chondroitin promote healthy joints and fluid joints so that they can improve mobility and reduce stiffness in any joint problems that your dog may be having. Another good supplement to have your dog on is omega-3, 6 or 9, or combine them if you can in a salmon oil. My two have that on their dinner pretty much every night. It goes down well with their dinner. But omega-3 again promotes healthy joints, fluid joints and healthy joints. So if you can afford the extra supplements for your dog, then those are the main three that you want to keep your dog on. However, must stress that once your dog has arthritis, supplements alone are not going to be enough to improve your dog's quality of life. They may do at the beginning, but once your dog reaches a point where arthritis is setting in and it's setting in hard, then you're going to need prescribed veterinary medication. So what else can you do with your dog other than just give it medication to help? When you have a dog that has a health issue, you feel helpless and you want to be able to do as much as you can for them. And there are some things that you can do to improve their quality of life and to help them get around that bit better. One of them is physiotherapy. Great for keeping muscle mass, keeping their joints supple and fluid, and making sure that there isn't any other joint issues that may occur while arthritis is setting into one particular joint or in a couple. To try and keep your dog as balanced as possible with physiotherapy, and that is a great way to do it. Massage is another one, along with acupuncture, Tellington touch. All of those are great, and I massage Nick's as his arthritic knee gets very warm when he uses it. So simple massage reduces the lactic acid buildup in that joint and quickly brings that temperature down so that he can get back to using it as he would. Last but not least is hydrotherapy. I am a big advocate in hydrotherapy. It turns out that his hips aren't the problem because he has been swimming religiously since he was 6. I had him in the pool every week since he was 6 years old. He will be 10 in September, and his hips are not the problem because he has great muscle mass build up around those joints, making them strong and stable. Nick loves his swimming. He absolutely adores getting in the pool, which obviously makes that therapy a lot easier for him to do and for me, because we both enjoy it. Not all dogs enjoy swimming, and I can completely understand that, but the benefits of hydrotherapy completely outweigh the fact that your dog may or may not enjoy being in the water. We will be going into hydrotherapy a little bit more on a separate video because there is so much to it. I would also be going into physiotherapy a little bit more as well, because we do that with my two. Although I'm not a professional in it, I do it on an amateur basis. Just to keep on top of my dog's muscles, core strength, and for fun. In some extreme cases where everything lines up perfectly, your dog is within the right age bracket, weight bracket, and is healthy enough to undergo a surgery, then that may be an option for you to go ahead with. Surgery is expensive, so having your dog insured is going to be top of the list. We were quoted For a total hip operation, we were quoted £6,500. My insurance group only covered me up to £4,000, which means that I was going to have to fork out £2,500 to get Nick's a hip operation, which luckily didn't have to go ahead because it wasn't the hip that was the problem. Big numbers when you start getting into arthritis and having to do surgeries, so making sure your dog is insured is definitely top priority, definitely worth it in the long run. So we've covered what arthritis is, what the treatments are, how it would be diagnosed, and possible alternative therapies and surgery options. So I think that's enough for one video for you for today, and I will be back with either hydrotherapy or a physiotherapy video next week. So stay tuned for that one. If you have any further questions about what I've gone through, what I've said, want to ask me any questions about what I'm going through, what Nix is going through, what medications your dog's on, what supplements your dog's on, list is endless about what you could ask. But if you want to, in the comment section for me, and I will get back to you as soon as I can. If your dog is going through the same thing we are, we'd like to hear from you. Let me know your story. Leave it in the comment section so that we can all see what everyone else is going through as well. Don't forget to subscribe for us, and I will see you on the next video. Bye guys.